Good evening, I'm Zaynab Ahmed and I'm going to present our work entitled Inspecting the Possible Effect of Coenzyme Q10 Supplement on Tumor Marker CA15-3 in a sample of Iraqi women with breast cancer. In a short brief, CA15-3 is a tumor marker used in conjugation with other tests and procedures aiding in monitoring treatment response, disease recurrence, as well as cancer metastasis. Coenzyme Q10, on the other hand, is a naturally occurring ubiquinone with antioxidant properties and takes a crucial role in cellular respiration. The objective of our study is to examine the possible effect of 2 months supplementation with coenzyme Q10 on serum level of tumor marker CA15-3 in women who had newly diagnosed with breast cancer in Iraq. The present work proposed to assess the use of coenzyme Q10 supplementation at different doses from those used in previous studies and without any combination with other antioxidant to examine its proposed effect on the level of tumor marker CA15-3. Materials and method. 71 post-operative women who were newly diagnosed with breast cancer stages 1, 2, and 3 before starting any chemotherapy distributed randomly into 2 groups. Group 1 or treatment group, those supplemented with coenzyme Q10 for 2 months beside chemotherapy AC, adriamycin plus cyclophosphamide regimen, while Group 2 or control group were undergoing AC regimen only. Results and conclusion. The serum level of coenzyme Q10 increased dramatically after supplementation with coenzyme Q10 for 2 months duration. At the same time, there was a non-significant reduction in serum level of CA15-3 in both groups at the end of the study. This table represents inclusion and exclusion criteria for our work. Those included women in this study were post-operative patients before starting chemotherapy AC regimen. The age group included 25 to 75 years old. The stages were 1, 2, and 3, which mean only stage 4 excluded from this study. And the included women were without any previous or current chronic diseases and don't take any chronic medication. And also we exclude any pregnant and breastfeeding women from this study. This table shows the patient characteristics concerning age, parity status, family history for breast cancer, menopausal status, and finally disease stages for both Group 1 or treatment group and Group 2 or control group. As you can see, there was non-significant difference between both groups. Using 2 sample t-tests, the result shows a non-significant difference between means of baseline reading for both coenzyme Q10 and CA15-3 tumor marker. If we see here CA15-3 baseline reading between treatment group and control group, the difference between means were insignificant. The same thing is true concerning coenzyme Q10 baseline reading between treatment and control group. There was also non-significant difference between both groups. According to the covariance analysis, there was non-significant difference between 2 groups after supplementation with the 2 months duration of coenzyme Q10 on CA15-3 level. As you can see here, p-value was 0.117, so it was non-significant difference from supplementation with coenzyme Q10 on CA15-3 level. At the same time, and according to the covariance analysis too, the result shows a significant difference between means of coenzyme Q10 after 2 months supplementation with coenzyme Q10 among those patients in both groups. As you can see, after supplementation with coenzyme Q10, there was a significant difference between 2 groups from baseline, and after 2 months supplementation, the p-value was a significant difference. In conclusion, the current outcomes reveal that there was a virtually depressed baseline level of serum CoQ10 in our sample. Patients who were histologically confirmed with breast cancer, excluding the 4th stage, supplementation with 75 mg of coenzyme Q10 daily was sufficient to increase the serum CoQ10 level dramatically. However, and at the same time, this dose was insufficient to significantly affect the serum level of tumor marker CA15-3. Different larger doses for longer duration of time with a larger sample size of patients are recommended in the similar future studies. Finally, thank you for your attention.